So I'm about to outline the areas that Karen is concerned about and that we're going to use Sculptra to correct today. You can see the soft tissue outline here. I'm actually going to trace it with a makeup pencil. And this is really the apple of the cheek that everybody talks about. And you can see right above the apple of the cheek there's a little bit of hollowing because the apple has kind of come down this way a little bit. So what we're going to do is we're going to add some volume that used to be here before to this whole area. And what it's going to do is plump up this whole fold. It's going to decrease some of the hollowing under the eyes, and it's going to get a little bit of a lift to her fold line, which has just really started here. We're also going to try a little Sculptra here up on top of the brow to give her a little bit of a lift, just a touch. This is all very, very subtle stuff. And then the same thing on the other side. And you can see we actually marked out these same areas on top of the brow and the apple of her cheek. Okay, what we don't want to do is we don't want to go too high. That gives you kind of an artificial look. So we keep the volume right below the corner of the eye. So if we draw a line this way right from the corner, we always stay below that on both sides. And we can see that what we've marked out here is perfectly symmetrical. So we know exactly where this product is going to go. After Karen is done with this treatment, she will have the look that we are going for. But with Sculptra, the key is that it takes several months for the collagen buildup on the bone to take place. So Karen will have an immediate correction that will last for about 4 or 5 days, and then that correction will fade, and she will look like she had nothing done. But over the next month or two, that collagen process will start, and it will gradually build up and give her a nice gradual change that she's looking for. She'll need to come back for a second treatment for sure, and maybe a third. And that is because the collagen buildup does take such a long time. You need to kind of jumpstart things with the Sculptra. So that's what we're going to do today. So you can see Karen is nice and relaxed now. We have her in a nice comfortable position. We have our areas that we're going to rejuvenate with Sculptra all outlined so we know exactly where we're going to put it. And we're going to start with Karen's temples to get that little bit of lift in the lateral brow that we were talking about. And it's going to be a little pinch, Karen. Just take a nice deep breath. Great. And we're done there with the temple. That's all there is. And now we're going to massage it in and just let that volume kind of redistribute. Okay, the temple's all done, and now we're going to move on to her left cheek here. Great, you're doing really good. You can see she's totally comfortable. We're about halfway done with our first side. And that's it. That's all she's going to feel. We're halfway done. Now we're going to massage what we just did. And massaging is a very important part of this, to distribute this Sculptra nice and evenly. And now we're going to do the other half of the treatment on this side of the face. You're doing great. Beautiful. Little pinches. And massaging is a very important part of this, to distribute this Sculptra nice and evenly. That's it for the left side. Let's take a look at the difference. So the left side has been done, and the right side hasn't. And look at how much more full and defined Karen's left cheekbone is. Look at the corner of her mouth on the left side, how it's just slightly lifted as compared to the other side. And look at the hollow underneath her eye. It's almost completely gone. She's got a little bit of redness and a few tiny little marks from the needles, which will be there for about 24 hours. But she could easily go out today with a little bit of makeup and look wonderful. Now it's time for the right. And we're ready to start the second side. Karen did beautifully on the left side. And you can see that she's got a beautiful correction in the soft tissue from little less than 2 cc's of Sculptra, which is a very small amount. She's got a little redness from all the massage that we did, but that's the extent of what she'll have. You can see there's no bruising, there's no blood, and there's really nothing to be afraid of for this operation. Look how comfortable she is. And here we go with the right side. We're going to start just as we did before. Karen, is going to be a little pressure and maybe a little pinch, but nothing uncomfortable. Here we go, a little pressure. And a nice smooth injection. You're doing great. And just as we did on the other side, we're going to outline the area that we want to fill with the Sculptra. All of our marks are still in place, so we know exactly where to go. We're being very precise and very gentle and very smooth about where we're putting this. And Karen is doing just fantastic. And now we're going to do the lateral component of this side. And again, you can see how comfortable Karen is. There's no blood, there's no bruising. It's a very simple, easy, smooth injection. And we're really outlining the cheek highlight now on the lateral part of the cheekbone. And this is where your makeup and flash bulbs and cameras and all of those things catch the light. And that's what we're creating now. And we are almost done here with this side. And we're going to finish with a little massage. So let's take a look at how we did. And this is Karen before. You all remember her. Very, very beautiful. And this is Karen after. And before. And after. Look at those cheekbones. Look at those eyes. And this is just amazing. Look at the difference in her face. She looks so much younger in her after picture, but it's very difficult to tell exactly why she does. And that's the natural, beautiful look that we were going for. And now it's your turn. Make your appointment today.